Welcome to EGC Medical. Today we're going to talk about vaginal yeast infection. If you haven't subscribed, make sure you hit the like and subscribe button for more videos. Okay, let's begin. Vaginal yeast infection. What is a vaginal yeast infection? A vaginal yeast infection is a type of fungal infection. Your body contains a kind of yeast called Candida, which causes vaginal yeast infections. Yeast is a type of fungus, and Candida is a specific type of yeast. When this yeast is in balance within your body, there are no problems. But when the yeast is out of balance, it rapidly grows, and you can get a yeast infection. A yeast infection causes burning, itching, redness in your vulva, the outside parts of your vagina, and changes to your vaginal discharge. A yeast infection isn't a sexually transmitted infection. Cause of vaginal yeast infection. It may be strange to think about, but fungus lives in several places within your body. The yeast that you have living in your mouth, digestive tract, and vagina is Candida. Normally, Candida doesn't cause a problem. It's supposed to be in your body, and other bacteria help keep its growth under control. However, certain factors make it hard for the good bacteria to fight off the bad bacteria. Sometimes, the bad bacteria win, and you end up with an illness. How common are vaginal yeast infections? Up to 75% of women will have at least one vaginal yeast infection in their life, and over half will get 2 or more in their lifetime. Yeast infections are the second most common cause of vaginitis, with bacterial vaginosis being the most common. What increases my risk of getting a yeast infection? Certain factors can increase your risk of getting a vaginal yeast infection. Some of those are using antibiotics, birth control pills, or certain steroids, being pregnant, having a health condition that weakens your immune system, having unmanaged diabetes. Certain lifestyle risk factors also increase your risk of a vaginal yeast infection, such as sitting in a wet bathing suit, not changing out of sweaty clothes, and wearing scented tampons or using a vaginal deodorant. What are the symptoms of a vaginal yeast infection? There are several telltale signs of a vaginal yeast infection. These symptoms can include an itchy or burning sensation in your vagina and vulva, a thick white vaginal discharge with the consistency of cottage cheese, redness and swelling of your vagina and vulva, and small cuts or tiny cracks in the skin of your vulva because of fragile skin in the area. A burning feeling when you pee. In some cases, another symptom of a vaginal yeast infection can be pain during sex. Symptoms of a yeast infection are similar to the symptoms people feel when they have a sexually transmitted infection, or STI, or other vaginal infection. Diagnosis and tests. How is a yeast infection diagnosed? Your healthcare provider diagnoses a vaginal yeast infection. You'll need to go in for an appointment and discuss your symptoms. Your provider may need to take a sample of discharge from your vagina to confirm a yeast infection. The combination of your symptoms and the discharge sample will tell your healthcare provider what type of yeast infection you have and how to treat it. Management and treatment. How do I treat a vaginal yeast infection? Antifungal medications treat most vaginal yeast infections. The specific medication depends on the severity of the infection. Your healthcare provider will prescribe the best treatment based on your symptoms and condition. Antifungal medications work by fighting yeast overgrowth in your body. Medications are either oral, usually given in 1 dose of fluconazole by mouth, or topical, used daily for up to 7 days. You may apply topical medications to your vaginal area or place them inside your vagina like a suppository using an applicator. Some common antifungal medications are miconazole, known as Monistat registered trademark, and turconazole. Your healthcare provider will give you information about each form of medication and directions on how to use each one properly. It's important to always follow your provider's instructions when using these medications to make sure that the infection is fully resolved and doesn't return. If you're taking medication for a yeast infection, you shouldn't have sex until you're finished with treatment. Sex can cause more irritation, and certain antifungal medications can weaken the materials used in condoms and diaphragms. How can I reduce my risk of a yeast infection? You can often prevent vaginal yeast infections by making a few lifestyle changes. These changes can include not douching. Douching can kill bacteria that actually control fungus. Avoiding the use of feminine deodorants, not using scented tampons or pads, changing out of wet clothing like bathing suits or gym clothes as soon as you can, wearing cotton underwear and loose-fitting clothes, using water-based sexual lubricants, keeping your blood sugar levels in a normal range if you have diabetes. The symptoms of a vaginal yeast infection are similar to other conditions. If you have any questions, a physical exam by your healthcare provider will help. We have come to the end of this video. If you liked it, make sure you like and subscribe. Thank you.